Hello again. This is Dr. Armin Segarra. This is now part 3 of a discussion on the physiologic form of the teeth and the periodontium. In the previous parts, we discussed about the proximal contact areas and I think just that. Now we're here to discuss about the interproximal spaces. The interproximal spaces are the triangularly shaped spaces formed by the proximal contacts and are normally filled by the interdental gingiva or interdental papilla. The contact area, because the two teeth touch each other, they form that space just cervical to it, and that space is filled with gingiva, we call the interdental papilla. The function of the interproximal spaces is that it allows sufficient bone tissue to grow between the teeth, thereby the increasing the anchorage between the teeth in the alveolar bone. So the other function is that it provides a sufficient space for the blood supply and the nerve supply of the periodontium. That interproximal space is important and should not be violated. Any encroachment in that area can cause gingivitis and can cause caries and eventual bone loss. We will see some examples of this later when we show clinical examples. The third physiologic tooth form is the embrasures, or known as spillways. I said earlier that the contact area, just cervical to it, creates a triangular space, and that space is filled with gingiva. We call that the interdental papilla, and we call that the interproximal spaces. However, that contact within two teeth provides or creates three other spaces, three other triangular spaces, and we call those spaces embrasures. From a buccal point of view, the um, uh, space that is created just occlusal or incisal to the contact area is called the incisal or occlusal embrasure. Now, from an occlusal or incisal point of view, looking at the contact area, that space, the triangular space coming from the contact area to the labial surface is called the labial or buccal embrasure. And of course, the remaining space, the space lingual to the contact area, is called the lingual embrasure. Thus, there are three embrasures always. It's the incisal or occlusal embrasure, number one. Number two, the labial or buccal embrasure. And number three, the lingual embrasure. What are the functions of embrasures? Well, number one, it reduces the forces that are brought to bear upon the teeth during mastication. That means during chewing, during the chewing cycle, wherein the food, a bolus of food, for example, is being masticated, the embrasures provide spillways or areas to escape for the food to escape. Thus, in so doing, it lessens the load on the teeth. Because of the embrasures or those escape areas or spillways, the load on the involved teeth is lessened. the the other function of the embrasure is to provide is to prevent food from being forced through the contact area. Because the food escapes to the embrasures, it actually just slides through the embrasures, following the embrasures, and massages the gingiva. If there were no embrasures, or very small embrasures, as you can see in a very square tooth, or imagine a tooth that is square with no embrasures at all, then the food that's being chewed has no area to go and escape. Thus, the food can and will be forced between the teeth, and it can cause gingiva, uh, caries, and eventual bone loss. We have discussed the third physiologic form. We will discuss in the next part the other two remaining physiologic forms. Goodbye for now.